We are here today with Karsor Kollie, who's currently seconded to Effect Hope from the Ministry of Health of Liberia, where he serves as Senior Global Health Advisor. He previously led Liberia's National Neglected Tropical Disease Program for over a decade, and during that time led one of the most ambitious real-world tests on NTD integration, embedding case management for multiple diseases directly into the health system. His team work, published in BMG Global Health this year, showed a fourfold increase in case detection and expanded access across 71 facilities. But beyond data, Karsor has navigated the hard realities of rebuilding NTD programs after Ebola, managing donor transitions, and learning what actually works at district level versus what looks good in policy documents. He brings exactly what the country implementing perspective this conversation is meant to surface. Thank you, Karsor, for being here with us.
So basically, from our analysis and from the research that has been done so far, the gaps are observed along so many of the health system building blocks, but however, critical among those are the governance, the financing, and also accountability. And at the policy level, integration is usually very clear. Strategies promote integration, service delivery, roles, and coordination structure are defined. But in practice, several challenges can emerge. Like I said, governance. And one thing about governance that needs to be very clear, that came up very clear as a result, is one of them is the autonomy posture of vertical program managers. So in countries where you already have vertical NTDs program, to do an integration, it's very likely that you're going to have some level of resistance because of the autonomy that already exists in these vertical programs. So Liberia had a very unique experience when the leprosy program was existing with the TB program. And to get it over to the NTD program, to get the leprosy program or unit over to the NTD program was a challenge. But we eventually succeeded because of the strategy we put, and the ownership of this approach of integration was taken by the entire Ministry of Health, including other programs. So that was one of the successes we had. But you can be assured that that is one of the challenges, especially when it comes to governance. Another issue under governance is the shifting program ownership to system. So it might be good to just focus on shifting the ownership to the system other than programs, and I still refer to the vertical programs. So in integration, your focus should be the health system and not on individual program. And one of the governance issue also is the financing policy that promote integration. But funding basically remains legally fragmented, especially from the donor perspective. So at country level, you are discussing integration. International level, at some policy level, integration is being advocated for. But you have donors interested in vertical program that challenge integration at national level. So what we've done in Liberia was government taking ownership and then have a pool fund that all partners, international partners, pool resources into one basket. That was aligned to the NTD case management plan, if you like, the NTD master plan, which is the bigger umbrella of the integrated skin NTD approach. So those were experiences for Liberia, but it's a challenge when you have fragmented resources intended for specific disease within the NTDs program, and it's not well coordinated. But Liberia was successful in having that coordinated, and that is very good experience that other countries can probably learn from.
Nice.
Yeah, so basically that summarizes the financial and the governance aspect of the challenge or the gap that existed.